Welcome Minor Matter Strength and Conditioning. My name is Oscar and I'll be your host. For previous videos and more progressions, please visit the channel. Alright, you're going to start with one of the basic exercises that is given usually after shoulder surgery. Regardless if you have a frozen shoulder or if you have like a tear labrum, these ones are going to help you in the long run. So these are called scapular retraction hold. And what I want you to do, you're not going to need any equipment. So what I want you to do is you keep your hands relaxed and then you're going to squeeze your shoulder blades by bringing them together. Now the objective is to try to hold it there for 10 seconds and then relax. So you can see how these small muscles have control not only on my posture, but also on my shoulders. Because when I go back down, my humerus, which is this bone back over here, internally rotates. So that's why doing these ones will help you. The only problem is that it's really challenging concept to grasp, because your elbows are going to try to help you out. So one exercise that I like to do is I like to pretend that their hands are relaxed, and as they're squeezing the shoulder blades, is pretend someone's shaking your hand. So have your hands both out in front of you, like you're shaking someone's hand, and that way you're not using your shoulder blades, you're not using your elbow, you're prevented from going forward, and relax. So squeeze your shoulder blades, and you're supposed to be able to move them, and then relax. Because the tricep will try to help you out by going back like this, which is good, but right now we really only want to work on your squeezing your shoulder blades by pitching your shoulder blades back on your muscles that retract your scapula, which is your middle trapezius and your, I forgot already, and that's rhomboids, major and minor. Yes! So you want to work on squeezing your shoulder blades, holding it for 10 seconds, and relax. So that way you're not affecting your shoulder, because after shoulder surgery you're not going to want to move your shoulder. The doctors recommend that you're not going to move it, but you can still do simple exercises that will help not only increase blood flow, but will help recovery time. Because you're still activating those muscles, but you're not doing any harm to your shoulder, because you're engaging your rhomboid major and minor and your middle trapezius, which do this. So hold it for 10 seconds and relax. And especially if you're in a sling, you're not going to want to move your elbow back. So you want to engage those muscles, hold it for 10 seconds, and then relax. Squeeze, hold it for 10 seconds, and then relax. Your body, after it gets fatigued, it's going to want to do this. So you want to try to prevent from doing that and go straight back. So pretend that kind of like you're elbowing someone in the back, trying to get their attention, but try not to use that elbow. So pretend that you're trying to get someone's attention without using that elbow, and then relax. So doing this 10 sets will help you and gradually build up, so that way you can do a ladder set which is 10 seconds, relax for a few seconds, 15, rest, 20, rest, 25, rest, 30, rest, 25, rest, 20, rest, all the way back down to 10. So gradually progress doing that, and that will help not only improve your shoulder recovery, but it will also help prevent other problems, because a lot of the issues that are related to shoulder injuries are commonly an underlying condition is bad posture, that usually from doing like this causes you to have weak and tight muscles. So when you're doing something like throwing, those muscles are weak, and that can cause an injury that can lead to a shoulder replacement surgery. And that's why doing these exercises will help prevent either if you had a shoulder replacement surgery, or you have a tear labrum or a frozen shoulder. These are exercises that you can do to help prevent those things from happening, and also rehabilitating your shoulder injury.